name is Dr. James Kinross. In March 2020, as the COVID-19 pandemic hit London, I was a frontline clinician serving in the NHS. Like clinicians everywhere, I was in an information desert, and I did not know how to treat this new disease. But by August 2020, almost 40,000 scientific papers, 1,500 policy documents, and 1,000 data sets had been published globally. Clinicians were drowning in a sea of conflicting data. Equally, policymakers were unable to turn this into clear, actionable clinical evidence for patient and staff benefit. The infodemic was exacerbated by the failure of the peer review process. The volume of data came at the expense of its quality and reliability. Academic data was misrepresented or misused, and public trust in prevention strategies was eroded, and ultimately patients were harmed. REDASA is an infodemic response platform. The strategic goal is to save lives by transforming the process through which infodemic data is processed into factual, quality-assured clinical evidence. The REDASA project is based on 3 innovations. Firstly, a proprietary web crawl pipeline which continuously archives structured and unstructured data and which performs intelligent search. REDASA is unique as we ingest peer-reviewed literature, academic or policy reports, social or grey literature, and raw data relating to any infodemic use case, and we turn this into machine-readable data. Secondly, we have a human-in-the-loop peer-reviewed platform called Curator. All infodemic data sets can be manually and semi-autonomously labeled, annotated, and quality assured by our global community of clinicians, biomedical researchers, and subject matter experts. Our pilots hosted 450 curators from 23 countries, and our goal is to scale this to over 10,000 active data curators within the lifetime of this project. The third innovation is clinical evidence summarization and veracity checking, and we're building an engine to do this based on natural language processing and artificial intelligence methodologies for the autonomous interpretation and reporting of data so that it can be seamlessly integrated into clinical evidence and patient engagement tools. These innovations are massively scalable. They're built on our lead partner AWS's AI stack, and our SME partners at Mirrorweb and CloudWick are already building these tools for governmental projects globally. We are committed to open data sharing, and we have already established an open data repository for machine learning community scientists everywhere. We know our objectives are ambitious. We need to develop methodologies not yet in existence, and the infodemic data challenge cannot ultimately solve by data science alone. Ultimately, we have to educate and change human behavior. Therefore, REDASA is a trinity of academic, industry, and government, and it can only happen with Trinity funding. The National Institute of Clinical Excellence in the UK has committed to the adoption of living systematic review data outputs, which will inform frontline clinical practice. And the IHME is the coordinating centre for the Global Burden of Disease Network, including all low-resource settings that have been hardest hit by the COVID-19 pandemic. MIT Solve support will mean we can build a global infodemic response methodology for COVID-19 and all future pandemics. Together, we are REDASA. Thank you.